Today our topic is on post-traumatic stress disorder. PTSD, which is post-traumatic stress disorder, is a mental disorder that can develop following exposure to or experience of a traumatic event. These events can be anything from a natural disaster or vehicle accident to an act of violence. Long-term exposure to traumatic experiences, such as military warfare or sexual assault, can also cause it. Hello guys! Welcome to our channel Health Tricks 24. I am Julie Jenkins from Health Tricks 24 and I will be presenting you the video today. Before we get into the video, make sure to click the subscribe button and hit the bell icon for more videos like this. Also like and follow us on other social medias. Make sure to turn on subtitles, caption for the video for a better experience. Now let's dive into the video. Flashbacks to the traumatic incident, avoidance of reminders of the event, unfavorable changes in thoughts and feelings, and heightened arousal, difficulty sleeping, quickly startled, are all symptoms of post-traumatic stress disorder. These effects may persist for months or even years after the traumatic occurrence, and they can have a negative impact on a person's ability to function and their relationships with others. Although anybody is at risk for developing PTSD, members of the military and emergency services are disproportionately affected. Not everyone who has through a stressful experience ends up with post-traumatic stress disorder. Those who are having PTSD symptoms should consult a mental health expert. PTSD can be effectively treated with a combination of psychotherapy and medication. The symptoms can be controlled and quality of life enhanced with the help of appropriate treatment. Post-traumatic stress disorder, PTSD, is a severe mental health disease that can develop following exposure to or experiencing of a traumatic incident. Flashbacks, avoidance of triggers, and cognitive and emotional shifts are just some of the symptoms that might result. These effects may persist for months or even years after the traumatic occurrence and can have a negative impact on the person's daily life and relationships. It's crucial to realize that there is no magic bullet for curing PTSD. Individual symptoms and requirements will dictate the course of treatment. Fortunately, PTSD may be treated, and there are a number of successful methods for reducing symptoms and enhancing quality of life. Number 1. Cognitive behavioral therapy, CBT, exposure therapy, and eye movement desensitization and reprocessing are all types of therapy that have shown promise in treating PTSD, EMDR. Individuals who participate in these treatments often report improved ability to process and cope with traumatic memories, detect and alter maladaptive thought patterns and actions, and lessen the severity of distressing symptoms. Number 2. Medication. PTSD is typically treated with antidepressants and selective serotonin reuptake inhibitors, SSRIs. It's advisable to consult a mental health expert to figure out which drug will work best for you and at what dose. Number 3. Practice good self-care by dealing with any underlying mental or physical health problems that could be making your PTSD symptoms worse. Among these are likely adequate rest, a balanced diet, and regular exercise. Having a support system of family and friends to lean on might also aid in the battle against post-traumatic stress disorder. Number 4. Coping tactics. Several coping strategies, including as relaxation techniques, such as deep breathing or progressive muscle relaxation, mindfulness, and journaling, can be useful in managing the symptoms of PTSD. Number 5. Support groups. Finding a community of individuals who have been through similar terrible experiences and talking about how they are making it through can be quite beneficial. Note that each person's treatment strategy will be tailored to their unique set of symptoms and requirements. Consultation with a qualified mental health expert is recommended to decide the best course of treatment. Therapies like cognitive behavioral therapy, CBT, and exposure therapy are frequently used to treat PTSD. These forms of treatment can aid patients in working through their traumatic memories, recognizing and altering destructive patterns of thought and behavior, and learning effective methods for dealing with their symptoms. PTSD symptoms can be managed with the use of medication. Common medications for PTSD include antidepressants and selective serotonin reuptake inhibitors, SSRIs. It's advisable to consult a mental health expert to figure out which drug will work best for you and at what dose. In addition, it is crucial to deal with any underlying mental or psychological difficulties that could be making PTSD symptoms worse. Among these are likely adequate rest, a balanced diet, and regular exercise. Having a support system of family and friends to lean on might also aid in the battle against post-traumatic stress disorder. Those who are having PTSD symptoms should consult a mental health expert. The symptoms can be controlled and quality of life enhanced with the help of appropriate treatment. This is the end of this video. Like the video and comment your idea about this video and support our channel. Thanks for watching our video.